everyone, I'm Assemblymember Bauer-Kahan, and today I'm really excited to host a conversation about how we can lower the risk of spreading and contacting COVID-19 to help flatten the curve in our community. We've started distance learning in my house, and I know I, like many of you, want to get our kids back into those classrooms, so we have to flatten the curve. So today we're going to learn more about how to do that. And with me today to have this conversation is Deputy Health Officer with Contra Costa Health Services, Dr. Radhakrishna. Welcome, Dr. Rohan.
Thank you so much. Pleasure to be with you.
Yeah, thank you for being here to share your expertise. So let's start with masking. Governor Newsom announced the statewide mask order in June, and since then we have gotten a lot of questions about masking. So let's talk about masks. Are there masks that are more effective than others? What masks are best for our community to be wearing?
Absolutely. Not all masks are the same. And when it comes to any type of prevention measure, it depends how often you do it and that you actually do it correctly. So one graph that you'll see here shows that masks are very powerful in reducing airborne transmission. This is a tricky virus with those invisible respiratory droplets. It's not just coughing or sneezing or singing, it's even talking, and they can travel many feet. So as you see in this diagram, those particles can be microscopic, small microns, and masks is really for both people to wear. My mask protects you and your mask protects me. And when both people are wearing it, it doesn't get out there and you have the shield. So you prevent the offense and you play defense at the same time. That's really important since more than half of people that are infected have no symptoms or haven't got them yet. So you need it on both sides to truly be effective. They say if 80% of people wear masks 80% of the time, it can be as good as a vaccine. We call that herd immunity, where enough people are doing it in the community that it decreases the spread, and it is very powerful. So you don't need to wear an N95 mask like a professional healthcare worker. There's a lot of low-cost options that you can purchase or even make in your own home. The key is, number one, that you use it 100% of the time. Number two, that you use it properly. And number three, that you use the best mask for you. So they've done studies in Florida and on the East Coast looking at different type of masks and how much it decreases the spread of these microscopic droplets. And with a simple cough, it can travel more than 8 feet. When you cover with a simple bandana, it may limit the spread for up to 3 feet. When you add a face cover that has one layer, it may decrease it to 1 foot. And when you wear a cloth face cover that has at least 2 layers and is stitched and quilted, it can decrease the spread to 2.5 inches. They've done studies on mannequins as well on live humans, and it shows that the type of mask can make a difference. So as you see on this county risk management diagram, there's a lot of options available, but the key is the more layers, the better, and wearing it properly really matters. You may have heard that those athletic gaiters or those bandanas are good for nothing. Well, it does something, but the better it's fit, the thicker the layers, the more effective it is. Now it's counterintuitive because it's summertime and we want to be comfortable, but the more breathable it is, the more likely things can pass through. So ideally you want something that's at least 2 layers. The World Health Organization says 3 layers is even more effective than 2 layers if you're actually stitching it at home, but it doesn't need to be fancy. The other important thing is that you actually wear it properly. It's like contraception. You got to use it 100% of the time and use it properly in order for it to be effective. So you want it to fit snugly on top of the nose and to use that nose bridge when available. And you also want it to cover your chin properly since those droplets can sneak out from above or below. So make sure you're wearing it snugly and that it's covering all sides. And you also want to avoid touching your face. Humans touch their face 25 times per hour, and that can spread particles from surfaces to the mouth and the face and back. So make sure it's comfortable so you're not touching it a lot. Finally, you'll want to wash and care for it daily. And there's a lot of don'ts as well that people mistakenly think they're protected, but don't wear their mask properly. So you don't want a mask that's actually upside down. If the bridge is on top with a little bit of metal or elastic, you don't want to be wearing it upside down so it's loose and hanging. You don't want to wear it like this so those droplets can still come out the noses. Those are doors and orifices that particles can spread and go out and come in. You don't want it too high where things can come from below the chin, and you don't want it really loose as well. If you have glasses, people get bothered by the fog, but you can actually wash it with soap and water, and that little film on your glasses will protect the condensation from fogging it up, so you can comfortably wear a mask with glasses as well. So the key is use it 100% of the time, use it properly, and find something that actually fits for your face.
Wow, that was really helpful. I found the ones with the ear, the things where I can adjust behind the ear, work really well for me, because then I can get the tight fit. So we all have to figure out what works for us, right?
That's right.
So kids, I'm a mom of 3. Do you advise the kids wear masks, and how often, and what's your advice on that?
Absolutely. I have several young ones as well. And the law in California and in our county is that children aged 2 and up must wear face covers. We know it can be challenging, but there's a lot of ways to get around it. You know, kids can actually be role models for adults. Now we have kids reminding adults that they need to put their seatbelt on and play it safe, that they shouldn't be smoking. And the same should go for masks. Kids should be our role models and remind us adults that we should always wear them. So here's one that my daughter helped sew with some fun owl materials and animals on it. Here you can see some old towels that we use to stitch it at home. So you want to make it fun, let them choose it, let them decorate it, let it have symbols that speak to them. And you know, you can come up with games against the germs, using it as a shield. And it really is an act of love and empathy for the whole family to protect each other. You don't want a kid getting the virus and passing it on to an elder. So the law is that children above age 2 should wear it. Below age 2, it can actually be asphyxiation risk for breathing. So over age 2, it should be used. And again, you want it to fit properly. So even if you have larger masks, you can buy those little plastic things that help you cinch it down over the ears to get a better fit. Now, we know childcare centers have been operating for many months and they're doing their best, and you're not going to kick a kid out if they're not wearing it. But the important thing is to create the culture that all members of the family age 2 and up should be wearing a mask to the best of their ability. Of course, there may be some disabilities, facial anomalies, breathing difficulties where you may have a note from your doctor that it's not recommended. There are many alternatives that we're seeing in childcare as well, such as the facial shield with the drape that goes down below. So they're all alternatives. We want to be practical and reasonable, but know that we're in this for the long term, and it is currently our best defense.
I mean, that statistic you gave, where if 80% of us were wearing it 80% of the time, it would be as good as a vaccine. That's amazing, because we already have the masks, right? So we can do that, and we don't yet have a vaccine. So hopefully
virtually free, no side effects, and it's something we can just keep in our pockets to protect ourselves. So it's really about creating the culture that this is the right thing to do for yourself, for your family, and for your community, and to be proud when you wear your mask.
Yeah. So hiking, biking, and running. I know there's been some discussion about that and whether masks are required or helpful during that time. What's your advice?
So whenever you go out, you should carry one with you. It's hot this summer. You should take water with you and always have a facial cover in your pocket. I do all 3 of those activities to stay well during these prolonged stressful times, and I always carry a face cover with me. It's an act of courtesy that when you're within 20 feet of another person, you'll bring the mask up. And of course, when you're doing vigorous, strenuous exercise, you may be exhaling and your particles can go further, such as with singing. And so you do, even though it's a few seconds that you're crossing another person, want to bring the mask up and model it again when you're out in the community. But please get outside, exercise, release your stress, stay healthy, but don't leave home without it.
I saw the cutest thing a friend had done the other day, which is take one of those glasses chains that people put on glasses so they can hang their glasses, and she put it on her mask so that it was always available to bring up. So there's fun. People are being creative about how to always have them on them.
Brilliant. And keep one with you, you know, buy a dozen that work and fit for you and your family members, and keep them in your purse, in your backpack, in your car, on your bike. So you got them whenever you need them.
Yeah, that's smart advice. So talk to me about changing out your mask, disinfecting them. What's the advice on that?
So we recommend that you clean your mask daily. Again, if it's a cloth face cover, simple soap and water will do. You don't have to run a cycle in your washing machine. You can wash it in the sink and just let it air dry. We recommend reusing them rather than having the disposable surgical masks that people don't necessarily need. The cloth ones are just fine. And good old soap and water, just like for our hands, works great for removing the virus particles from fabric as well.
Got it. So let's talk about enforcement of mask wearing. I think this is one of the questions that I hear a lot. I went into a business and nobody was wearing a mask, or I see a lot of people out not wearing masks. Can you talk about what the county is doing to enforce the masking order?
Yes. So our goal is education, not incarceration. And we really want to focus on places where people gather, such as businesses, to really follow the law and be the models for our community. You don't need to tattletale on that 3-year-old biking that has their mask down. But if there is a high volume business that isn't, you can report it to local law enforcement. So the County Board of Supervisors did pass an ordinance, number 2020-21, that says both for businesses as well as individuals, they need to follow all of the health officer orders, which includes physical distancing as well as covering your face. And that means that it may start with the warning, could then lead to a citation and actually a fine. Fines start at $250 for businesses and $100 for individuals. So we do take this seriously. Think about smoking. There was a time where you could smoke inside of a shop, on a bus, and it took decades to really change that culture. And now it's actually against the law, and you can get a citation or an infraction for smoking and exposing other people. Well, the same is true for masks. We know through science and data that it does protect your neighbor and yourself. It's not only the right thing to do, it is the law. So now there can be financial penalties for not following that law.
It's such a good analogy. I remember when there were smoking sections in restaurants, and you're right, it was hard for people to adjust, but we need to adjust fast to masking because this virus.
Yeah, the difference here is we don't have time. We don't have decades to create that culture change that secondhand smoke can harm others, but secondhand breathing and invisible virus particles can infect others. And so we need to make that culture change fast. And we're very grateful for the patients and the public. It's been a fatiguing marathon. And really, this is the new normal of facial covers. The good news is it protects us from other viral particles. Of course, get your influenza vaccine when it drops late September, early October, but these type of prevention measures will protect us from various respiratory illnesses, not just coronavirus.
Oh, that's great to know. And I go to the Capitol almost daily, and we are all in our masks all the time because we're essential workers like you are and have to be in our workplace, and we know it protects each other. So hopefully everyone will follow our lead. So let's talk a little bit about what we know about how people are contracting COVID and why the numbers continue to vex us. So what are the data trends showing you about how people are contracting COVID-19 in the area?
So it's mid-August 2020, and unfortunately, 11,000 Californians have died. Almost 11,000 Contra Costans have lab-confirmed tested, likely many, many more. We have over 150 who have passed away of our friends and relatives here in Contra Costa County. And right now, more than 100 individuals are actually hospitalized with it. We've learned a lot through our contact tracing, our army of these disease detectives that speak with individuals who have tested positive to decrease that curve and decrease the spread. And what it's taught us is that over half of cases have been from contacting it with people within your own household. So density is a risk factor. If you live with more than 6 people in the same household, people that may not have a lot of housing options and are crowded does increase the risk, but that's why you want to play it safe and not expose people outside or inside your home. 20% of the cases have been from in the workplace, and we're grateful to our essential workers, our grocery store workers, our healthcare workers, our farm workers, our transportation and cleaning workers, but it is risky work. And so that is a factor for sure. Another 20% get it from being out in the community by engaging in certain essential activities and maybe slipping up on some of the precautions. So we've learned a lot from our data. And to continue to know what the virus is like in our backyard, we really ask for your participation with our contact tracers. There's a lot of fear, a lot of stigma, a lot of shame when someone tests positive that you may not want to tell who you were around with. But the truth is, speaking with our team is another act of compassion that helps us decrease the spread, especially to your loved ones and others in the community. It's sad in New York, they've actually had to issue subpoenas to get people to cooperate with public health and let them know who they may have had a close contact with, been within 6 feet for a continuous 15 minutes per the CDC definition of a close contact. But the more you can trust us and work with us, the more we can keep your family and community safe, and hopefully get back to school and back to work. So please work with us, and that way we can learn how the virus is spreading in our community.
That's so important that people are able to answer that phone and help us identify who needs to get tested and stay at home until we know that they're not COVID positive to decrease the rate of spread. How would one know that it's a contract tracer calling them, since people are concerned that it's fraudulent? Do you have any advice?
Sure. So they shouldn't be asking for, financial information. They shouldn't be asking for immigration status. They'll identify themselves as from the county health department. They'll be professionals following protocols and guidelines. There is a lot of fraud going on. You can always verify and call back, but please know that we are here for you. And the more we know, the better. Back in July, we were able to find out for every lab confirmed positive case, we were getting names for at least 3 individuals that they were in contact with. That helps us decrease the spread. Now we're only hearing about 2 names, so people are sharing a little less. There is fear and concern, but the more you trust us, the more we can squash this virus. This virus can have a reproductive rate of 2 to 5. That's the R0 value in epidemiology, the spread of disease science. And what that means is one person can actually pass it on to 2 to 5 people. That's exponential. So that 5 people becomes 25 and then 125 within 3 rounds. But if we find out who you may have been in contact with and we can get those people to stay home and get tested, we can decrease that R value to 2 or even 1, which keeps the disease stable. You can see the multiplication. 2 to 4 to 8 is much less than 5 to 25 to 125. So the more you can work with our teams and follow our advice, the more we can crush that curve and get back to work and back to school.
That's great advice. And I love those numbers because I think it really hits home the importance of doing all the things that county health is recommending for us. So let's talk about that. What advice do you have for slowing the spread for those of us that are out and about running errands or doing essential business in the community? What's the advice? What's the latest?
So we have a great infographic that we'd like to share with you here on tips to slow the spread. We know you need to move on with your lives. Of course, our mantra is face, space, hands, home. Cover your face, maintain 6 feet of space, wash your hands, and stay home whenever possible. It's a saying you can teach your kids and the kids can remind us about, but we do need to move on and get on with their lives and have some type of safe interactions outdoors and of course do our essential functions. So there are tips we offer for every facet of daily life that this infographic shows. So if you're gonna be with family and friends, we recommend against the handshake, the hug, and the kiss. Keep it to a wave or a namaste or a gesture from afar to avoid that close contact. Meeting outside in smaller groups, people within your bubble or household is recommended. Not having loud voices or singing and chanting, but keeping it to conversational tones and cleaning those high-touch surfaces is important. If you are traveling with others, limiting the number of passengers that is possible, avoiding touching those surfaces, trying to increase airflow with windows down and more ventilation, and washing and sanitizing your hands, carrying around 60% or greater alcohol desanitizer, or good old soap and water works. And if you are going out to work as an essential worker, again, staggering those shifts, not letting your guard down. We've even seen outbreaks amongst hospital workers that are having a social lunch and sharing a meal and talking. So keeping all of those prevention advice up. When you're chewing, you can have that mask up, but when you're putting the food in your mouth, bring it down. Otherwise, really keeping that space. Avoiding shared work environments, telecommuting whenever possible. And so we know that life needs to move on, and that's why we've created this graphic for you. So if you're with friends or family in the home, in the workplace, or engaging in transportation, there's a lot of easy tips you can do to lower risk.
Thank you for that. So one of the things that you mentioned is fatigue, if you will, of what's going on. And we are social human beings. People want to be engaged in social behavior with other community members. And so what I'm hearing a lot of is, outdoor social gatherings, right? So backyard gatherings, walks outside. How safe are those?
So unfortunately, gatherings are one of the causes of transmission. There are ways to do it more safely. As you say, we are social creatures and we are hungry for interaction. Virtual just isn't the same. And this is an ultramarathon lasting months. So there are safer ways to go about your interactions. This next graphic that we'd like to share talks about knowing the risk. Life is a spectrum of risk, and we all have different risk tolerances. On one side, you can see safer choices, and on the other side, you can see riskier choices. You may choose based on your own health situation, living situation, or your own doctor's advice, how much risk you're going to take. So if you're around those with chronic conditions or of older age, you probably want to play it more safe. Safe choice may be, for example, gathering outdoors with a smaller group, members of your own household, people from within that social bubble of 12 groups or people or less that are stably interacting, and of course, following that same advice. If you are having an outdoor barbecue, covering your face, maintaining that distance. If you're going to play a game in the park, let it be where you're playing football and kicking a ball around rather than something where there's close contact. So there are a lot of other ways. If you're sharing food, to not do it buffet style, to BYOU, bring your own utensils, and maintain part of that bubble phenomena of sticking to people within your own household. But if you are interacting with others, following those prevention advice, even if you're in an outdoor setting. But we definitely know that outdoor is lower risk. The fewer people that are mixing, the better. And again, covering our face, an act of compassion for those we're gathering with.
Thank you for that. So this has been so informative and helpful. I obviously engage in these conversations all the time, but every time I talk to you, Dr. Rohan, I learn new things. So thank you so much for joining us today and sharing your expertise. And, COVID-19, like you said, we're in this for the long haul, and it continues to bring challenges. But the more we learn and the more we listen to our health experts, the better we can keep our community safe and slow the spread of the virus and get back to, as Dr. Rohan said, life as we knew it, going into our workplaces, getting our kids back to school. So let's do this together. I mean, my biggest takeaway today, I think, is if 80% of us are wearing it, 80% of the time, it's as good as a vaccine. So hopefully you'll take that away as well. Those masks really make a difference. Let's all do our part. So as always, my office is here to support you, as is the County Department of Public Health. Their hotline is great. I've called it myself. So don't hesitate to reach out to either of us if you have any questions. My office can support you with any help with state agencies. So you can reach us at 925-328-1515. And thank you for tuning in, and stay safe.